Now, when it comes to bloodborne pathogens, in hospitals, I've found that when we do assessments in hospitals, majority of the staff members, they're doing a great job. They're following the infection control policies. They're making sure that they're conducting everything on the correct schedule. They're making sure that people are getting their vaccinations, their Hep B vaccinations, their flu vaccinations, but they're not following up. And this is when the just-in-time observations take place, where washing schedules, as I mentioned before, if hand washing is followed strictly in a healthcare environment, that will prevent disease transmission. That will prohibit the flow of bloodborne pathogens. If your schedules are being followed, if staff members are making sure that they follow the procedures that's taking place within your medical facility, and you will have the less transmitted diseases among staff members. You'll have staff members, and then also too, if you have staff members, when it comes, you have your annual vaccination, but observations, if someone is coming to your workplace and they work there and they're not feeling well, then you have to make sure that they stay home. So your administrative controls and your engineering controls play a great part into what takes place in your facility, because you have to deal with your bloodborne pathogen. You have to deal with slip, trips, and falls.
For more information, click on the link below or visit databrackets.com.